Okay, in this video we're going to talk about how we can possibly draw the innervation to the forearm and the hand in a quick and easy manner so that we have this one testing. So I've gone ahead and drawn out a brief diagram here that we're going to work through. So the big thing that you need to know is that there are three nerves that are going to continue from the upper limb into the forearm and down to the hand. The first is the radial nerve, then we have the median nerve, and then we have the ulnar nerve. And we're going to go through each one of these pathways one at a time. I like to start with the median nerve, so that's what we're going to do here. The median nerve is going to travel down through the middle of the upper arm. It's going to pass into the cubital fossa. Remember, it's the most medial structure within the cubital fossa. And as it's passing down to the forearm, in the region of the cubital fossa, it's going to go ahead and give off its first branch. And this is going to be the anterior interosseous nerve that it is giving off. So that's our anterior interosseous nerve. Then the median nerve continues down all the way through the wrist, and it's going to pass through the carpal tunnel and into the hand. Now, in the hand, it's going to give off a branch that's going to wrap around and come backwards towards the thenar compartment of the hand, and that is called the recurrent branch of the median nerve. So, recurrent branch of the median nerve. Then it's going to continue towards the first two fingers of the hand. Okay, so that takes us through the general pathway of the median nerve. We're going to go back through and talk about the different things that it innervates along its path, but now let's take a moment and talk about the ulnar nerve. So the ulnar nerve, as we know, is going to pass through the upper limb, and it's going to pass behind the medial epicondyle, which I have drawn in blue here. So it's passing behind the medial epicondyle, and it has no innervation above the forearm. Now in the forearm, it's going to innervate 1.5 muscles. It's going to pass down towards the hand with outside of the carpal tunnel, and then it's going to go into a superficial and deep branch within the hand. Now that deep branch of the ulnar nerve is going to be doing most of the musculature of the hand, whereas the superficial is a primarily sensory nerve. Okay, so that takes us through the general pathway of our ulnar nerve. It's giving off branches to our fingers. And now, lastly, the major nerve that we need to know is the radial nerve. So the radial nerve is coming through the posterior aspect of the arm, and it's going to pass into the cubital fossa, and it's going to pass right underneath the belly of the brachioradialis muscle as it continues its course down to the posterior aspect of the hand. Now, along this course, it gives off a branch that's going to be superficial. That's going to do skin innervation. This is going to be the superficial branch of the radial nerve. Now, as the radial nerve is passing into the extensor compartment of the forearm, it's important to note that initially it's going to be called the radial nerve. It's going to pass through some muscles. And this is actually where, so we'll do it up here. So radial nerve, then right here it's going to branch into the superficial branch, and then the distal portion is going to be called the deep branch. It's going to pass through some more muscle bellies, and then once it passes through those muscle bellies, we're going to call it the posterior interosseous nerve. Okay, so this one's going to be the posterior interosseous nerve, where the superficial branch is continuing all the way down to supply sensory information to the dorsum of the hand. That posterior interosseous nerve, however, is doing most of the motor innervation to the extensor compartment of the forearm. So now briefly going through what each one of these nerves is doing along its path in the upper limb. I'm going to start with the median nerve. The median nerve is going to be innervating structures such as the pronator teres, the flexor carpioradialis, the palmaris longus, flexor digitorum superficialis, and distal branches. That anterior interosseous nerve that we give off, it's important to note that that does very specific muscles. That's going to do muscles of the deep compartment of the flexor forearm. So it's going to do half of the flexor digitorum profundus, specifically the aspects that are more lateral or closer to the thumb. So go to the first two digits, or digits 2 and 3, if we're counting 1 as the thumb. It's also going to do the pronator quadratus and the flexor pollicis longus, because those are all within the deep compartment of the forearm. Okay, then when we're in the hand, we have the recurrent branch, which is going to be doing all of the muscles of the thenar compartment. And then we're going to have two distal aspects called palmar branches, which are going to do the first and second lumbricals. So the first and second lumbricals. Okay, and that is all the motor innervation for the median nerve. So big overview for median nerve. The median nerve is going to do most of the motor innervation to the flexor forearm, and then a little bit of motor to the hand as well. So a lot of flexor forearm, little bit of hand. That can be contrasted to the ulnar nerve, which is going to do a little bit of the flexor forearm. So a little bit of flexor forearm, but it's going to do a whole lot of the musculature of the hand. So the ulnar nerve coming down It's not doing anything at the upper limb. When it gets into the flexor forearm, it's going to do 1.5 muscles. So it's going to do the flexor carpi ulnaris, and then it's also going to do the other half of the flexor digitorum. And so that flexor digitorum, that is doing flexor digitorum superficialis, profundus specifically, it's going to be doing the more medial half. And that those two tendons, or the muscle bellies that it innervates, are going to be going to digits 4 and digits 5. Alright, so that's the ulnar nerve as it's passing in through the flexion compartment of the forearm. As we go more distally, this is where we're going to have that deep and superficial ulnar nerve coming off. The deep ulnar branch is going to be doing the intrinsic muscles of the hand. So pretty much all the musculature that the recurrent median nerve and common digital branches of the median nerve are not doing. So the primary motor innervation to the hand is going to be via the ulnar nerve. All right, and lastly, we talk about the radial nerve. So the radial nerve, as it comes down, it's going to be piercing through the supinator muscle, and that's where it's giving off this deep region. So the deep branch is going to be doing 2 muscles, the supinator, and it's also going to be doing the extensor carpi radialis brevis. Prior to this, prior to piercing the supinator, there are 2 nerves in the forearm that are innervated by the radial nerve before it gives off those superficial and deep branches, and that is going to be your extensor carpi radialis longus, so longus as opposed to the brevis, and then the brachioradialis. Okay, so I think about this as the brachioradialis and extensor carpi radialis longus specifically are innervated by the radial nerve. Then we get the deep radial nerve innervating the supinator, extensor carpi radialis brevis. Then all the other muscles in the extensor compartment of the forearm are innervated by the posterior interosseous nerve. So I think of this as a pair of 2, and then everything else. Okay, so that's the general pathway of the radial nerve. And the radial nerve is not doing any of the musculature of the hand, it's just doing sensory innervation to the dorsum of the hand. Okay, so radial nerve only doing sensation to the dorsum of the hand, and that's via that superficial branch of the radial nerve. And with that, that's a quick drawing and overview of the innervation of the forearm and hand.